Type 2 diabetes is a condition in which the blood sugar level is too high. After eating foods rich in carbohydrates, chemicals in the small intestine break them down into single sugar molecules called glucose. Next, the cells lining the small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches the pancreas, beta cells inside the pancreas detect the rising glucose levels. To reduce the glucose level, the beta cells release insulin into the bloodstream. As the blood circulates through the body, insulin and glucose exit the bloodstream into the tissues to reach the body cells. Most cells of the body have certain receptors on their surface that binds to the circulating insulin. Insulin acts like a key in a lock to open up the cells so that the circulating glucose can get inside the cell. Now, the cells can use the glucose to produce the energy it needs to function properly. In type 2 diabetes mellitus, the cells resist to insulin. Due to insulin resistance, the insulin cannot unlock the cells to let glucose in because the locks cause the receptors are abnormal or missing. As a result, glucose is locked out of the cells. Consequently, the amount of glucose built up in the bloodstream resulting in a condition called hyperglycemia. To compensate for hyperglycemia, the pancreas produces more and more insulin. The overworked beta cells try to keep up with the demand, but gradually lose the ability to produce enough insulin. Certain organs such as the brain need a constant energy supply to function properly. Because the brain's primary source for energy is glucose, it is the first organ affected by the lower glucose levels. When the brain cells cause the neurons are starved for glucose, they start to malfunction, causing symptoms such as nervousness, shakiness, and confusion. If the glucose level continues to drop, the electrical activity of the neurons diminishes significantly, resulting in seizures or diabetic coma. If treatment is delayed for hyperglycemia, diabetic ketoacidosis can result because of less insulin circulating in the blood, so the cells cannot get the glucose they need to produce energy. As a result, the bodies tend to fats and proteins as an alternative source of energy. During the fat breakdown process, certain byproducts known as ketone bodies accumulate in the bloodstream, resulting in a condition called ketosis. If ketone build up to dangerously high levels in the bloodstream, a condition may develop called diabetic ketoacidosis or DKA, which can lead to coma and death. Another complication resulting from failure to treat hyperglycemia is called hyperosmolar hyperglycemic non-ketotic syndrome or HHNS. As the insulin deficiency continues, the blood glucose level increases. In response, the kidneys filter excess glucose out of the blood into urine along with large amounts of water. Unless consuming large amounts of water, the kidneys cannot keep up the demand of removing the glucose from the bloodstream. As a result, the blood becomes much more concentrated than normal, a condition called hyperosmolarity. Hyperosmolarity pulls water out of the body tissues into the bloodstream, causing severe dehydration, which may lead to hyperosmolar hyperglycemic non-ketotic syndrome.